Two words that describe almost every disease plaguing Americans today are the words chronic inflammation. The CDC now states that 6 in 10 people have at least one form of chronic disease. These diseases include a long list of conditions that doctors treat daily: hypertension, diabetes, thyroid disorders, including Hashimoto's, autoimmune conditions like rheumatoid arthritis, systemic lupus erythematosus, or SLE, inflammatory bowel diseases like Crohn's or ulcerative colitis, atherosclerotic heart disease, which leads to stroke, heart attack, heart failure, allergies, and asthma, other respiratory conditions like COPD, inflammatory skin disorders like psoriasis, rosacea, and eczema, and cancers. It's pretty obvious at this point in our medical evolution that instead of trying to treat one specific disease at a time, we should know that our bodies are whole and synergistic. It may be a lot smarter to work on root causes to multiple conditions. That would mean we get whole person outcomes where multiple conditions are reversed or eliminated at the same time. In this case, chronic inflammation could be considered to be a type of root cause that we should be working on, right? That way, we'd be able to reduce rates of more than one of those diseases I just rattled off. Now, because you're listening to this video, you're much smarter than a $5.7 trillion healthcare system that currently treats only one disease at a time. Go figure, expecting a different result. This is the point where we can choose to open our minds and embrace the intelligence of our own bodies, knowing that we've been given powerful natural tools from a higher form of intelligence before we were born. We're talking about 3 of the most powerful peptides discovered so far that can help us to combat chronic inflammation with very little side effects because they were made from substances found in our own bodies. In this video, I'll provide a short summary of the benefits of 3 peptides, including KPV, thymosin alpha 1, and thymosin beta. Of course, there are many more peptides that can help reduce inflammation, and likely many more to be discovered since there are at least 7,000 different peptides in our bodies. Let's start with KPV, not to be confused with the KGB, which is a Russian mafia organization and not helpful to your optimal health at all. KPV is a gorgeous little peptide made of only 3 amino acids. It's primarily used to help decrease inflammation, although its mechanisms are not completely mapped. Studies show benefits of KPV with intestinal inflammation and immune system responses. What's interesting is that KPV, like the KGB, works in stealth mode from inside cells where it inactivates inflammatory pathways. KPV can be safely used with other peptides, including BPC 157. Check out our other videos for more information on BPC 157 and other great peptides. Okay, I just have to tell you that I know nothing, absolutely nothing about the KGB. I hope they won't come after me like the FDA might, since the FDA doesn't seem to like us sharing information on helpful natural substances to improve our health. KPV can be taken as a pill, applied topically, or given via injection. My second favorite peptide is thymosin alpha 1, or TA1. Keep in mind that what I'm talking about is not medical advice. If you want to use any of these peptides to assist in your own health journey, please consult a qualified licensed healthcare professional. Thymosin alpha 1 is a powerful immune system booster. It helps restore immune system function of the thymus gland, which was a pretty powerful piece of machinery when we were invincible kids, but has become this decrepit, tiny, almost non-functioning, long-forgotten little thing in our upper chest as adults. TA1 is currently being used to treat CIRS, chronic inflammation response syndrome, Lyme disease, and other autoimmune conditions. It's used as a preventive treatment against viral infections such as COVID-19 and in certain cancer treatments, chronic fatigue syndrome and fibromyalgia, diabetes, metabolic syndrome, chronic stress, depression, gut biome problems, and low scores on SAT exams. Now, before you get all hot and bothered about thymosin alpha 1, please take careful note that your SAT scores are exclusively dependent on how well you're able to use AI on any given day and not on any illicit use of unapproved peptides. Second, the FDA has not approved of thymosin alpha 1. And because it lacks FDA approval, it cannot be legally prescribed or distributed by pharmaceutical companies. The FDA has strictly prohibited 503A compounding pharmacies from producing or distributing it. But as we're quickly learning on this channel, TA1 has been approved in over 35 countries internationally under the brand name Zadaxin. Well, this has been a depressing video, and we might liken the root cause of our depression to the FDA. But there's always hope for infectious diseases that plague us. Thymosin beta 4, TB4, or TB500, is related to thymosin, a hormone secreted from the thymus gland. If you listen to the end of this video, I'll share with you some promising information about upcoming FDA changes to their current policies. TB500 plays an important role in tissue repair because it enhances collagen deposition, promotes rapid wound healing with little to no scarring, and works to support tissue stem cells to heal injured tissue. It's also a potent anti-inflammatory for wounds, muscles, and joints, and is a potential therapy for HIV, AIDS, and influenza. It works in muscles to prevent muscle loss or sarcopenia, which happens naturally as we age and don't exercise, or when Hollywood body positive activists secretly take GLP-1A receptor agonists and tell you it's natural weight loss. Since the heart is one great big fat muscle, TB500 can help post-heart attack as well. TB500 can be used in combination with BPC 157 for gut healing properties, but has also been used in patients diagnosed with traumatic brain injury or concussion. And most importantly, it's been shown to stimulate hair growth, which could potentially put hair transplant surgeons completely out of business for a few cents on the dollar. Now, you have more knowledge on the benefits of the top 3 peptides for chronic inflammation than your average conventional doctor. There's some good news. By the time this video comes out, the FDA will hopefully have approved KPV and TB500 on the 503A bulks list, which means you can work with your doctor on using these peptides. So instead of walking down a dark, lonely alley to buy your healthful peptides from some research-only dealer in a trench coat, these peptides will be approved for use in American humans only. Now, what they'll be approved for is the topic of another video. Although your local peptide dealer is a very nice person, please be sure to work with a qualified health practitioner if you're considering adding peptides to your health treatment programs. This would be a great time to like, share, and subscribe to this channel for more helpful health information that the FDA will surely not approve. And go ahead and make sure to list your favorite peptides in the comments below. Maybe you don't agree with what I've said. Let's talk more about health versus disease care. I've also written a book that will help you examine the exact point where our disease-focused healthcare system has hijacked the way you think about health and leads you toward more sickness. My book is called The 7 Principles of Health, Your Call to Health Consciousness. Check it out on Amazon. Take great care of your health. And thanks for allowing me to share this important bit of your time learning about peptides that are beneficial for chronic inflammation and your overall health.